Hello and namaste everyone. As a continuation of our talk on osteology of skull, today we are going to talk about the anterior view of the skull, that is Norma Frontalis. It includes the facial or anterior aspect of the skull, which appears oval in shape, being wider superiorly and narrower inferiorly. For proper understanding of the anatomy of the face, we should first study the features on the anterior aspect of the skull. The prominent features in this view are the orbital openings, anterior nasal apertures along with the anterior aspect of the frontal bone, cheek prominence, bony external nose, and teeth bearing upper and lower jaws. On the superolateral aspect of the anterior nasal aperture, quadrangular orbital openings are present bilaterally. Orbital opening is basically aperture of pyramid-shaped orbital cavity, which houses the eyeball and its associated structures. The four margins of the quadrangular orbital opening are supraorbital margin, the infraorbital margin, the medial orbital margin, and the lateral orbital margin. The supraorbital margin, which is also known as superior orbital margin, is formed by the frontal bone. On its junction of medial 1/3 and lateral 2/3, we will find supraorbital notch and sometimes, as in this case, supraorbital foramen, through which supraorbital nerve and blood vessels traverse. Supraorbital nerve carries the pain sensation from the forehead and scalp region, and its compression may sometimes cause migraine headache. The infraorbital margin is formed by the maxilla medially and zygomatic bone laterally. It acts as attachment site for levator labii superioris muscle. An infraorbital foramen for passage of infraorbital nerve and vessels is present below the infraorbital margin on the maxilla. The medial margin of the orbit is less pronounced and it is formed by the frontal bone and the frontal process of the maxillary bone. In context to medial orbital margin, we can mention medial palpebral ligament 2, not seen here. It extends from medial canthus of the eyelid to medial orbital margin. The lateral margin of the orbit is formed by the zygomatic process of the frontal bone and the frontal process of the zygomatic bone. Nasal aperture is a pear-shaped or pyriform opening present on the anterior midline aspect of this view. The inferior margin of the nasal bones bound this aperture superiorly, while the nasal notches of the maxilla bound it inferolaterally. Cartilages of the external nose are attached to the margins of the nasal aperture. Through the nasal aperture, we can observe the bony nasal septum, dividing the nasal cavity into right and left parts. The anterior part of nasal septum is cartilaginous and it is not seen here, and the posterior bony part of nasal septum is formed by vomer posterior-inferiorly and perpendicular plate of ethmoid antero-superiorly. Lateral wall of the nasal cavity bears three bony shelves known as concha or turbinates, and the spaces below these conchae are known as meatuses. Here we can see the inferior concha and its underlying inferior meatus where nasolacrimal duct opens. On the inferior border of the nasal aperture, a sharp bony projection known as anterior nasal spine can be seen at the top of intermaxillary suture. This spine supports the septal cartilage of the nose, and during repair of the nose or rhinoplasty, anterior nasal spine can be altered to configure nasal projection and support. Some authorities also claim the anterior nasal spine to be a unique feature of Homo sapiens. However, others have noted similar spine in chimpanzees too. The anterior aspect of the squamous part of frontal bone forms the forehead. Inferiorly on either side of median plane, this part of frontal bone articulates with the nasal bone by frontonasal sutures. Nesian A median point in nasal root is present at the junction of frontonasal suture and the internasal suture. The inferiormost part of the internasal suture is known as rhinion, another cephalometric landmark. Cephalometric landmarks help surgeons in planning and operating. Superciliary arch, also known as supraorbital ridge, is a smooth, curved, bony elevation situated above the superior margin of each orbit. It is relatively more pronounced in males. Glabella, which is derived from Latin term glaber, meaning smooth, as we use in glabrous skin, which indicates hairless, thick skin, is another important cephalometric landmark. It is a smooth median elevation which is present between the two superciliary arches. Skin over glabella is sometimes used to assess state of dehydration. Frontal eminences or frontal tubers, which are two rounded elevation on anterior aspect of the frontal bone, are present superior to the superciliary arches. Ossification of the frontal bone begins from these eminences, and these eminences tend to be more pronounced in children and in females. The two frontal bones during development are separated by a midline frontal suture. Sometimes, as various texts quote, 3 to 12% of the population may have persistent frontal suture, which is called the metopic suture. Metopic suture should be kept in mind when viewing the radiograph of the skull, so that it should not be mistaken with fracture of frontal bone. Cheek or malar prominence is formed by the body of zygomatic bone and is seen on inferolateral aspect of the orbit bilaterally. Zygomatic bone on its lateral surface shows presence of zygomaticofacial foramen, which accommodates nerves and vessels of the same name. The frontal process of the zygomatic bone projects upwards and articulates with the zygomatic process of the frontal bone. Similarly, temporal process of the zygomatic bone extends backward and articulates with the zygomatic process of the temporal bone, forming the zygomatic arch, which we are going to talk about in the Norma Frontalis. Bony external nose, a part of nasal bridge, is formed by bilateral nasal bones and frontal process of maxilla between the orbits. Upper jawbone or maxilla is present mostly on the lateral aspect of the nasal cavity, and it is involved in forming the boundaries of the orbit, the nasal cavity, and the oral cavity. It occupies middle aspect of the facial skeleton. Maxilla has a zygomatic process and a frontal process extending towards the zygomatic and frontal bones. Inferiorly, alveolar processes are present which house the upper denture. On the anterior surface of the maxilla, landmarks such as infraorbital foramen, the canine fossa, and incisive fossa are encountered. The infraorbital foramen is present 1 cm below inferior orbital margin. Inferior to the infraorbital foramen is the presence of canine fossa, which lies lateral to the canine eminence. The canine eminence is produced by the long and prominent root of canine. Canine fossa is the site of origin of levator anguli oris, which elevates the corners of the mouth. In the past, Caldwell lock operation used canine fossa to access maxillary sinus and drain it. Comparatively less prominent incisive fossa is seen medial to canine eminence. It is the site of attachment of nasalis and depressor septi muscles. Lower jawbone or mandible forms the lower aspect of this view. Mental foramen situated below the second premolar tooth is present bilaterally on anterior aspect of mandible. Mental nerve and blood vessels pass through this foramen. Mental nerve is responsible for providing sensation to the chin and lower lip. mandibular symphysis or symphysis menti is a midline vertical ridge, which is not always distinct, present on the external surface of the mandible, which indicates fusion of two halves of mandible during development. The widened inferior triangular prominence of symphysis menti is known as mental protuberance. This is an important feature of Homo sapiens jaw. The base of mental protuberance is depressed in the center, however, it is elevated on the sides, and these elevations are known as mental tubercle. Mandible is the second bone after clavicle to start ossification during intrauterine life. Additional anatomical aspects of mandible is dealt separately. It is also interesting to note that the three foramina, which are the supraorbital, infraorbital, and mental, are situated in the same vertical plane through which sensory branches of the three divisions of cranial nerve 5, that is ophthalmic division of trigeminal nerve, maxillary division of trigeminal nerve, and mandibular division of trigeminal nerve, pass. So, this was a brief description of Norma Frontalis. Thank you for watching.